I'm going to tell you about the project. We just started, so I don't have very much data, but I will give you an introduction on the project, and I'll happy to present more results in 1 year. So my name is Elena Levtchenko. I'm a pediatric nephrologist working in Leuven, Belgium. And this young lady is Louisa Medal. She is a PhD student on this project. So as all of you know, cystinosis is a multi-organ disease. It affects initially kidneys and the eyes, as we have just heard now, but it affects also other organs, such as endocrine organs, the thyroid, the pancreas, but also other organs such as brain, lungs, but also the muscles. And our project is going about the muscle disease and cystinosis. So many of you know that during the lifetime, a lot of cystinosis patients would experience some degree of muscle symptoms. The muscle disease mostly starts with a decreased strength of hands. The movements which are typically become difficult is to open a bottle or a can. But we see also muscle weakness in the feet muscles, in the arms and legs. Some cystinosis patients also experience impaired swallowing due to the weakness of pharyngeal or esophagus muscles. Many patients experience also problems with their voice, and they get weakened voice or hoarse voice due to the weakness of the larynx muscles. And some of the patients can also experience difficulties with breath due to the weakness of the diaphragm and the intercostal muscles. And this altogether impairs severely the quality of life and also increases the risk of mortality, especially because of the risk of aspiration pneumonia, which is a very severe complication. And here you can see the typical view of the hands of the cystinosis patients. So you see the atrophy of the small muscles of the hands. And if you perform a more detailed imaging, this is MRI images of the legs, you see that while normal muscles are looking like these gray areas, some muscles would be replaced by fat tissue. You see these black areas, it's actually fat tissues, and it can be really quite pronounced. And when you look in more detail at the muscles of cystinosis patients with electron microscopy, you will see these typical cystine crystals, which are found in a lot of muscle tissues. So these are results of a very recent study published in the Kidney International Reports this year. The authors studied the grip strengths of adult and children with cystinosis, altogether large group, 76 patients of different ages and different degrees of kidney insufficiency, because we know that chronic kidney disease as such impairs strength of the muscles and muscle function. And they have found that all cystinosis patients, or a lot of them actually, independently on the degree of chronic kidney disease, had some degree of impaired grip strength. And here you can see that the normal line is actually this red line, and these are the grip strengths which are measured in different patients depending on the degree of chronic kidney failure, and many of these patients would have the decreased grip strength. While a lot of patients had objective decrease of grip strength, only 1/3 of these patients reported symptoms, which is quite good. And what was important, that physical activity really improved the muscle strength, and the male sex and the older age at start of cysteamine treatment were the negative risk factors which were associated with impaired grip strength. So these are the results of the old study, which were published in New England Journal of Medicine by the group of Bill Gohl in the 90s of last year. They did the imaging of the swallowing in cystinosis patients, and normally in the normal person, where you swallow the food bolus containing the contrast, you will see the nice passage of this fees through the larynx, esophagus to the stomach. But you can see here that in cystinosis patient, this food is blocked at different parts of their larynx or esophagus, meaning that this patient would really experience the swallowing difficulties by eating different food. And so those were patients in the 90s, and more recently we performed a very simple test in cystinosis patients. All of them were treated with cysteamine. So actually we were not expecting a lot of problems in our patients. This test is called the Thomas test. It's a very easy test. The patients are asked to eat this simple cracker, and you measure the number of bites, the number of masticatory cycles, so just chewing cycles, and the number of swallows. And you compare the results with a normal subject, and we also compare the results with patients with severe muscle disease, which is muscle dystrophy. And we were actually negatively surprised by the results, because our cystinosis patients scored not only worse than control subjects, which you could expect, but also worse than patients with a muscular disease, meaning that their chewing and swallowing function was severely impaired. And most of these patients were actually young adult patients. So the muscle disease is also demonstrated in the cystinosis mouse model, which was so far instrumental in studying cystinosis disease and also novel treatments. And you should not be a specialist while looking at these microscopic images. Here you can see the muscle fibers in the healthy animals, and these are muscle fibers in their mouse suffering from chronic kidney disease, but not cystinosis. And you can see that their muscle fiber area is much smaller in cystinosis mouse model, and this is quantified here. You have a smaller fibers, and when they measured the grip strength, you can also measure it in the mouse model. You see that the grip strength in the cystinosis mouse is really decreased compared to the control mouse, and also decreased when you compare it to the mouse suffering from chronic kidney disease, but not the cystinosis. So also in this model, there is evidence of chronic muscle disease. So fortunately, we have the cysteamine treatment, which reduces cystin accumulation in different organs. And in most of the European countries, we have now two preparations: immediate release cysteamine cystagon or slow release cysteamine procysbio. And the good news here that cysteamine really protects against myopathy. And this again, the old study, but still very actual, from the group of NIH, showing then cystinosis patients who are not treated with cysteamine, about 80% of these patients would develop muscle disease at a certain age, while patients who are on cysteamine treatment will have muscle disease in much lower percentage of the patients, and some patients would also not develop muscle disease. So cysteamine is still a very good treatment, also not only for kidney disease, but also for muscle disease. However, many of you know that despite cysteamine treatment, and I've just shown you the data, a lot of the cystinosis patients will still develop a certain degree of muscle weakness, and probably cysteamine cannot prevent muscle disease in all patients. And so in our project, we were searching for the new therapies for this problem. So what we are going to do, or what we are already doing in our project, we are busy to develop their human-based muscle model of cystinosis disease. Why? Because the muscle structure is not fully reflecting their human phenotype. And for testing therapies such as gene therapy, you really need the muscle models to test gene therapies, because the gene applications are really specific for the species, and it's much better to test gene therapy for humans in the human model rather than in the mouse model. And obviously, this study will be beneficial if the results are successful. And also, if you think about therapies and about the weakness of specific muscles, you can imagine that you can apply eventually therapies, especially gene therapies, in the certain muscles, not in the whole body, which can also be beneficial. And there are examples from other diseases on this topic. So what we are doing now, we were able to obtain myoblast cells. Myoblasts are the precursors of muscle cells, and these cells are coming from teres. And we used the CRISPR-Cas technology. This is a molecular technology which allows you to cut the healthy cystinosis gene out of these muscle cells. And using this technology, you can generate an in vitro model of cystinotic human muscle cells. And so this is already done, and this is what Louisa has done in the laboratory. Of course, when you do this, you have to prove that the cells which you have developed really have the defect in the cystinosis gene, and this you do by sequencing cell by cell, because this technology is not working in all cells, so you have to select cells where this molecular manipulating is successful. So this is already done, and the good news here in the clones where cystinosis gene could be manipulated, we do see a clear cystin accumulation in this clone. So the technique is efficient, and these cells can be used for their further studies. So of course, these myoblast precursors are not real muscle fibers, so you have to differentiate them in the muscle fibers. And during this differentiation, these precursor myoblasts, they proliferate and they start to fuse like the skeletal muscles are also doing, and you form the multinucleated fibers. And this we have done, and the good news is that cystinosis cells can differentiate in something which you can see here, which really resembles muscle fibers that we find in patients and in the healthy subjects. So this is a very good model which can be used to test therapies and eventually to test gene therapies. So now to some examples. Actually, gene therapy is already used in different muscle diseases, and the most known are Duchenne muscle dystrophy. There's already therapies which are at the clinical trial phase, and there is an example which is very known from baby Pierre, where gene therapy is used to treat spinal muscle atrophy. And there are also other diseases when gene therapies are already in the clinical trial phase. And so what we have done, we developed the gene therapeutic vector. It's a lentiviral vector containing the healthy cystinosis gene. And we transduced cystinosis muscle cells, which I just have shown you with this lentiviral vector. And we started actually to study the effects. Again, the good news is that transducing their cystinosis muscle cells with this vector results in cystin accumulation. Here you can see that cystin accumulation in the healthy cells is very low. It is high in the cystinotic cells, and when you transduce these cells with this gene therapy, you can see the substantial reduction of cystin back to the normal levels, which is, of course, very, very important. And when you use a control vector, which does not contain the healthy cystinosis gene, we don't see any reduction. So this is a good first result, but of course, we would like to know whether the function of these mini muscles is improving, and this is what we are doing now. Actually, we are performing the functional test of these mini muscles to demonstrate that this gene therapy not only results in the cystin reduction, which is already a good, nice step, but also in improving muscle function of these cells. So these the results so far. I don't have real conclusions because the project is really ongoing. I just only want to think on people, you see that there are several people who are working on this project, especially Rick Jaspers, who is from the Leuven's viral vector core. He is in charge of generating these lentiviral vectors. And Maurilio Champoalesi from the Stem Cell Institution in Leuven. He's a specialist in developing mini muscles, kind of muscle organoids from muscle precursors. And these two guys, together with Louise and myself, are mostly working on this project together with other people in the lab. So here I would like to stop by thanking all of you for the interest in our project, also for financial support of this project. It's very important for us to continue this research. And I'm happy to take your questions now, or you can send me your questions also by email. So I'll give you back the word.